So King County has hundreds of thousands of people living with a mental health condition, and the chances are high that you or someone you know is affected. And that's why the National Alliance on Mental Illness Seattle hosting an event this weekend talking about the importance of ending the stigma of diagnosis and getting care. Joining us now, the Executive Director, Paul Gretzel. Good morning, Paul. Thanks so much for joining us.
Good morning.
All right, so data from 2021 showing 22% of U.S. adults had some sort of mental illness, and on average, it takes people 11 years to seek care.
Right.
I mean, what's the holdup there?
A lot of that, as you said, has to do with stigma. So there's this sort of belief in that perhaps mental illness isn't a clinical condition, but a moral failing. That seeking care might be an admission of weakness. That in some cultures, it's sort of like not common to seek care.
I mean, is there a certain portion of the population that is less likely to seek care? Because I know as a guy, going to the doctor, for example, like a lot of times, we'll put it off, we'll put it off. Does that have anything to do with it?
Absolutely. Men are less likely to seek care for a lot of reasons, for the way we view medicine in general, and sort of this tendency to want to sort of buck up and try to work through any of our problems.
Okay, so we also have some new numbers. More teens and young adults dealing with mental illness since the pandemic started. Why would that be?
Well, we had a lot of social isolation, as everybody knows.
Right.
Sort of that social development is so important for kids to get in there, especially teens. Get in there, develop social skills, learn how to deal with each other and the world. A lot of kids are trapped behind screens and not able to walk the halls with their peers for years. At the time, it was really crucial to develop socially.
And we've also talked about the danger of so much screen time and about social media and what that can do to a kid's self-esteem.
Exactly. So even before the pandemic, the exposure to what all of us see on Facebook, so some of that negative messaging, images, and video can be really harmful for kids.
Okay, so what are some ways that teens can get the help that they need?
Well, first of all, they should be aware of the crisis resources. So there is 988, the new number around sort of mental health. It's not 911. This is specifically for people in crisis. That is there for kids. Also, in most schools, particularly in Seattle public schools, have started to invest in mental health, and in most school districts are seeing the importance now. There are school counselors and clinicians on campus.
Okay, so you have a Stigma Free Seattle event. This is happening on Saturday. Talk about the resources and activities that are happening there.
Well, we're really excited about this. So there's the stigma piece around trying to get folks to sort of squash the stigma and get past that. But we're also celebrating mental health and all the ways people achieve their best mental health. So we're going to have collaborative art projects, because creativity is part of mental health. We're going to have a lot of our resources and partners, and we're going to have, what are we going to have? Some live programming, live music, artistic activities. We may have some puppies there. I'm not sure if we're going to have that. That's always very therapeutic.
You bet.
But we're just really excited for that one piece around celebration of our mental health, but then also pushing back against stigma so that folks feel safe to go get care and achieve their best mental health.
All right, so you can see all the information there happening at the Vera Project 11 to 4 on Saturday. Paul, thank you so much. Paul Gretzel with the organization. Thanks so much.